Oh, you're from Bangalore.
Bangalore.
Short rotator chin, appendectomy, young age. Just that. Look at the side. Yes. Classical case. Will give you very good result, okay? When do you want the surgery?
Today.
Today only. Okay, one question. You want to have a very strong jaw, like a very strong masculine jaw, or just a jaw that's proportional to your face?
Very strong.
Very strong jaw. Which means I will be moving your chin by about 14 millimeters. Quite a lot. More than that, if I do, I'll have to put some artificial bone substitute or bone graft, which you don't need. I've seen your scan. We'll be able to give you good result. When did you have food last?
Today morning 7 o'clock.
7 o'clock. So we can do your surgery after 8 hours. That means 8, 9, 10, 11, 12, 1, 2, 3. Around 3 o'clock we can do your surgery. Don't even drink water now.
Okay, sir.
Nothing. You've come alone or you have some relatives? Alone. फिर इनका पहले ready करो. Then you go with her and they will do your blood scans, everything, and they'll take you on top and you have to wait there for 3 hours. 3 o'clock we'll start your surgery.
Yeah, I can expect a scar face.
This much area will come forward. It will be proportional and it will be big, 14 mm. You can expect a huge improvement. Very good improvement you will get.
Very difficult to open your mouth. Then this problem is let's see. This is days 5 after we've done a chin augmentation. We're going to show you the results in a moment. Just taking off this tight dynaplast. 1 second. ಆಯ್ತು ಒಂದು ನಿಮಿಷ. ಅದು ಏನು ಮಾಡಿದರೆ ಕೂಡ ಸ್ವಲ್ಪ ನೋವಾಗ್ತದೆ. ಜಸ್ಟ್ ಜೆಂಟ್ಲಾಗಿ. ಆಯಿತು ಹೀಗಾಗಿ. So you can see the improvement. ನೋಡಿ ಸೈಡ್ में एक बार दिखाओ. ಸೂಪರ್ ಆಗಿದೆ ನೋಡಿ ಸೈಡ್ನಲ್ಲಿ ಆಗಿದೆ. ಆ ಥರ ಕೈ ಬಿಡ ಹೀಗೆ ನೋಡಿ तेरिदिल्ला. So आपको मालूम पड़ रहा है, you can see the difference in this area. It's got a nice jawline. So we've removed that double chin. We've got nice skin that's elevated. Shape अच्छा हुआ है. Huh? Everything is really good. Asymmetric.
नहीं, correct है. वो सूजन रहता है ना प्रेशर की वजह से, इसकी वजह से. लेकिन बहुत बढ़िया है.
परफेक्ट है। आप घर जाते लोग पूछेगा आपको अच्छा लग रहा है, आपका फेस बहुत अच्छा हो गया ना पहले से, एक बैलेंस हो गया। पहले ये सिर्फ छोटा था बाकी अच्छा था, नाउ यू गॉट फुल बैलेंस टू द फेस। ठीक है, सो क्या करना है, यू टू टेक केयर, और 1 महीना लगेगा फॉर फुल हीलिंग। सो डोंट टेक एनी chewy फूड, टेक गुड मेडिकेशंस, टेक गुड केयर ऑफ एवरीथिंग, देन वी विल बी एबल टू मैनेज। फोटोज निकालो उनका, पोस्ट ऑफ मेडिसिन सब दो और डिस्चार्ज करो उनको फटाफट।